At what point does carrying extra weight stop being a health risk and start becoming a disease by itself? For some, obesity is silent, no symptoms, no struggles, but for others, it creeps into the joints, the lungs, the heart, and even the liver. This is not just about weight anymore, this is about damage, real damage. Today, I'm going to show you the moment obesity crosses the line from something you could manage by yourself by adjusting your lifestyle into something that must be treated like any other illness. We're going to be talking about two concepts, what we call preclinical obesity and clinical obesity. So let's start with a concept that's not often discussed, preclinical obesity. This is when a person has obesity, but this has not developed into any obvious organ damage or physical limitation. At this stage, obesity is like a risk factor. Many people at this stage, they feel generally fine. They will be active, maybe working and not taking particularly any medications. The risk is simmering in the background, but generally they are okay. What about the other type of obesity, of what we call clinical obesity? This is when the excess fat that you have from obesity can start to kind of cause damage around your organs, not make them function the way they should be, and maybe limit your ability to perform daily activities that should be normal for your age. At this stage when obesity is no longer just a risk factor, but a disease in itself. Medical surveys suggest that about 50% of patients with obesity are not aware of possible medical problems which could happen due to the excess fat. This figure is quite concerning. It just tells us how much we are failing as a medical community in educating our patients. I will tell you a little bit more about diseases that could be associated with obesity, and certainly the list is very long, but I will focus on 8 organs which are directly affected by excess weight with very strong medical evidence to suggest so. This is not to scare you, but rather to educate people with obesity about what they need to watch for so they are vigilant of any symptoms that could develop, as these may indicate the start of a dysfunction in one of their organs. So let's start with the first thing, is joints. Osteoarthritis, particularly affecting the large joints. So if you have a lot of weight, then that would affect your hips and the knees, because these are the big joints that hold all the weight that you have. So if you have a little bit more weight for these joints to hold, then over time they could be affected and they start having a little bit more wear and tear than it should be for the time, and that leads to what we call osteoarthritis. So the symptoms that you might have will be something around pain in the joints, kind of restricting your mobility and ability to walk around, and that could unfortunately lead to further weight gain because you can't exercise as normal, and that becomes more like a vicious circle. So joint arthritis is something to watch for. Now, the second thing we're going to talk about is how the airways could be affected by excess weight and excess fat. So some people, particularly the people who develop a little bit of fat deposition around their neck and they have a little bit more like a shorter neck in size, they might run into some problems with their airways, particularly when you are asleep. So what would happen usually is that if you are sleeping, then this kind of fat around your neck will press a little bit more on the airways, and that would lead to a little bit of a stoppage of the breathing in the night. So this stoppage of the breathing in the night, we call it sleep apnea. So what would happen is that during the night, as you stop breathing, you kind of sleep and then wake up, then sleep and then wake up. That interrupted sleep would lead to you feeling generally tired during the day. So you wake up, you don't feel like you had a good sleep. So things that you need to watch for to know whether you have sleep apnea. One of the things will be very loud snoring. It might be that your partner noticed that you stop breathing during the night. So if you develop any of these things, then you could be having what we call sleep apnea. Sleep apnea is manageable, but the management usually relies on having a breathing mask during the night that keep the pressure in the airways high so you could breathe throughout. And people who have what we call CPAP machine, the mask, they could see a very, very good improvement in their sleeping pattern, and they feel much fresher in the morning than when they had the sleep apnea and treated. The third organ we're going to talk about is the heart. So the heart, as you know, functions as a pump that kind of pushes the blood across the whole body. And one of the things that could happen with the heart in people with obesity is that it could get weakened. If you get a weakened heart, then that would lead to you feeling much more short of breath when you're doing exercises, and maybe even when you are lying flat in bed. It's one of the dangerous things that can develop from obesity, and you certainly need to have that checked by your doctor. The other organ that we need to talk about is the pancreas. It is the organ that produces the hormone called insulin. Insulin is the hormone that brings the sugar out of the blood into the different organs to be used. Now, if your insulin is not working well, then what will happen is that the sugar will build up in your blood and they will have high blood sugar. High blood sugar is a disease that we call diabetes. So how the obesity affects this is that the excess fat can cause what we call insulin resistance. So the insulin level in your blood is high, but the organs are not kind of reacting to the insulin in the way they should be. So as the insulin goes higher, they are resisting the work of the insulin, so the sugar is not going into the different organs to be used, and sugar is building up in your blood. And if it builds up in your bloodstream, you're going to have a high sugar level, or what we call diabetes. The next organ, which is very essential organ we're going to talk about, is the liver. So the liver is the big factory that sits around the upper part of your tummy, and this is the factory that gets rid of most of the toxins in your body. Now, if the fat builds up with deposits in the liver, you got what we call fatty liver. So fatty liver, that means that a lot of fat is depositing in the liver. At the early stages, it might not be dangerous, but if you have more fat depositing in the liver, that could cause more inflammation in the liver, and the liver start having problem with the function, and that could develop from what we call fatty liver disease, or what we call fibrosis and then cirrhosis. And in very rare cases, but they do happen, patient might have liver failure. So that is again a very essential organ that could be affected by obesity. The other organ that is very essential and could be affected by obesity is the brain. So in some people, particularly women in reproductive age, they could develop what we call idiopathic intracranial hypertension. It just means that the pressure of the fluid around the brain is very high. And if that happens, then they could have a lot of symptoms, including severe headaches and blurred vision. In some cases, if that condition is not treated well, these patients might unfortunately develop blindness. So it is one of the conditions that are directly linked with obesity, and it does improve significantly once the patients lose weight. That will take us to the last organ I'm going to talk about today, which could be affected by obesity, and this is the reproductive organ. We're talking here about sexual hormones and fertility. In men who have excess fat, they could develop what we call hypogonadism. So this is a condition where the men have lower levels of testosterone, leading to them to have reduced muscle mass and then erectile dysfunction and low levels of sperms. And this is again one of the conditions that are directly related to obesity and could improve if the weight is addressed. In female, there is a condition of what we call polycystic ovary disease. Again, there is a strong association between that condition and obesity. This is where the women will have higher weights and they struggle with ovulation, the period become very irregular, and a lot of the cases, unfortunately, they have problems with fertility. Again, this is one of the conditions that could improve with weight loss. Now that we are familiar with some of the important clinical conditions that could stem out of obesity and they are strongly associated with it, let's talk about management. How do we manage obesity? We started the video by dividing the obesity into preclinical obesity. That's when you got obesity but you don't have any medical problems out of it. And clinical obesity, and that's where you started to have organ dysfunction or limitation in your normal activities due to obesity. So the management will be a little bit different. In preclinical obesity, we could have supervised programs where you could follow diet, but maybe be part of a group or have somebody to watch your diet to educate you a little bit more about your health options rather than trying to do it yourself. In some cases, you might need medication, and some patients might go for weight loss surgery as a preventative measure. If you have clinical obesity, it's a different thing because that is a disease by itself. And at this stage, we need to treat it like we treat any other diseases by evidence-based treatment options. So think about it like if you have diabetes, asthma, or any other medical problems, you would go to your doctor and seek help. And it's the same if you have clinical obesity, then you're required to be reviewed by a doctor who is a specialist in treating obesity. Management options might include supervised program, lifestyle changes, as we talked about before in the preclinical obesity, but you might also need medications. You might even need weight loss surgery based on the assessment that you will have by the specialist at the time. Why this shift in thinking matters? When we recognize the time when obesity moves from being a risk factor to a disease, it's not just about labeling, it's about accessing treatment. If we only wait until complications appear, we are already too late. But if we can identify patients and treat clinical obesity early, we can prevent strokes, diabetes, heart failure, infertility, and certainly help a lot of people reclaim their quality of life. The next time someone says obesity is just about willpower, you will know better. It's about biology, organ function, and timely treatment. If you found this video helpful, make sure to like, subscribe, and share it with someone who might need to hear this. I am Dr. Qutayba Almerie, bariatric surgeon, helping you understand the science behind obesity and your health. See you next time.